very glad to be introducing Dr. Adam Seth Levine, our speaker for this session. Dr. Levine is SNF Agora Institute Associate Professor of Health Policy and Management at the Johns Hopkins Bloomberg School of Public Health. He is currently studying the role of science in American life, and in particular when scientists collaborate with civic and political leaders to address pressing public health, environmental, and other challenges. Dr. Levine is also president and co-founder of Research for Impact, a nonprofit organization that connects researchers, practitioners, and policymakers with similar interests. At Johns Hopkins, he teaches a variety of courses on the links between science, democracy, and health. I personally had the privilege of taking one of Dr. Levine's excellent courses while at Hopkins, and he's an exceptional professor. So Dr. Levine, welcome to the Global Health Leaders Conference. I'll turn things over to you.
Great, thank you so much for having me, and thanks everybody for sort of tuning in on a Saturday. And I know everybody's in very different time zones, and so for some folks it might be really late. For some of you, it might be really early. I am right now in Baltimore, Maryland, so Eastern time zone of the United States. And so for those of you who are in the same time zone, well, it's the middle of the day. And so it's great to be here. And I want to, I do have some slides I want to share. And I'm going to do this sort of like sharing screen thing in a bit. But before we do that, I want to do like just a couple of sort of like introductory things and also ask all of you a question and give you an opportunity to respond to it in the chat box. So first of all, as like, thank you for that wonderful introduction. So I'm a political scientist by training, and I actually sort of, and as you heard, like, I study sort of essentially the science of collaboration. When and why do people with diverse forms of expertise engage in collaborative relationships with each other to solve problems? And it's very sort of like problem and action oriented. Now, I want to sort of admit up front that, for those of you, everybody in this room right now and folks who are watching this, are interested in health in some way, right? And are already and are becoming sort of like really sort of big like health leaders. And, I want to sort of acknowledge like right up front that like, when I say that I'm interested, that I study like the science of collaboration, at first blush, they might not seem totally related to public health or like global health topics, right? Like I'm not here to talk to you about like all of the latest detail and sort of what we know about, say, HIV, or what we know about sort of like, the climate impacts of health or mental health or any other like sort of, or gun violence or topics like that. And so, that's not what I'm here. I think you're going to have like many other amazing speakers throughout the summer who are going to sort of speak to that. But my hope is that by the end of this session, I've at least persuaded you that this thing called the science of collaboration, which you may never have thought of before, which I totally understand, okay, is actually highly relevant to you, your interests, your aspirations, and your work as health leaders. Okay, so that's my goal. And so you'll let me know at the end if I've achieved that or not. So with that said, what I want to do to begin with is actually I want to put a question into the chat and basically invite you to answer. And of course, not everybody has to answer and whatnot, but I'm really curious just to get a sense of sort of who's in the room and how you would answer this. So the question is, I just put into the chat box, what kinds of science and health related topics are you interested in? And where you already have some kind of technical knowledge about it, okay? So I love the person who already answered, like, great, aging, immunology, okay, so now it's gonna get hard to read some of them, mental health, epidemiology, teen vaping, sports medicine, schizophrenia, a number of mental health, epidemiology, great, keep it coming, okay? I'm going to give folks like just a couple more seconds to answer. This is an amazing variety. And also really kind of underscores how sort of like, health is extremely big, public health. When we think about sort of like, population health and preventing health burdens and things like that, and health inequities, really touch on many different topics. I saw, wow. You guys, I love the participation. Here I was sort of worried in advance that like nobody was going to respond. This is great, great, good. So All right. So one of the things that sort of like, I think like, and the responses are still coming, and that's amazing and stuff. And so I want to sort of like, what this sort of really underscored, right, is like, how like, there are so many folks in the room, everybody in the room sort of like, you have technical knowledge about a science or health related topic. Okay. And to be sort of put it even more bluntly, rather, you have this technical knowledge and many other people don't. Okay. And I think that that's sort of like really, really important. So with that said, I want to sort of use that as a jumping off point. I'm going to share my screen. I want to sort of admit, and you all know Zoom, right? So like once I share my screen, I can't see the Zoom, the chat box anymore. And so feel free to put questions there, or maybe sort of, I can like kind of get a heads up if you have questions. Otherwise, there's definitely gonna be time for Q&A at the end. And, the goal is sort of not for me to sort of, just simply like, be like talking for, 45 minutes. The goal is definitely not for that. All right. So the title of the talk is Collaborate Now, and why that matters for improving health. And again, I have sort of affiliations both with Johns Hopkins University as well as Research for Impact. If you're wondering, by the way, if some of you may be familiar with like, there's a rock singer named Adam Levine, and A, I'm not him, and B, every time I get checked into a hotel, people ask me if I am him. So there you go. That's what it's like to share the name with a rock star. So as I just put into the chat box, what kinds of science and health related topics are you interested in that you already have some technical knowledge about? Okay. So again, we are all here because when I ask you that question, all of you can like, come up like very quickly with an answer. And you are all sort of like budding leaders in that area. And in part, what that means by being part of the Global Health Leaders Conference at Johns Hopkins, what that means is that like, not only do you have this sort of technical knowledge already, not only are you getting more of it and you aspire to get more of it, but also my hunch is for many of you, like, you are going to be in a position and you want to be in a position to influence policy, right? Like that is a goal. And that can really sort of take place in many different ways, right? Maybe it's going to be international policy. Okay. Maybe it's going to be sort of like, say, at the sub-national level. This is, if you're not familiar with it, this is the state house of the state of Wisconsin in the Midwestern region of the US. And maybe it's going to be even more local than that. So this is a county office building, county administrative office building in the US. This is in upstate New York. Regardless of what it is, and then of course there's like lots and lots of other possibilities and aren't even like depicted here, right? Whatever it is, the point is that like, you have this technical knowledge, you're going to basically, as a global health leader, you are already probably in some cases, and you will be sort of like seeking to influence policy. And when you do that, okay, the decision makers that you're going to be interacting with, they aren't necessarily going to know as much about the topic as you do, or at the very least, they aren't necessarily going to have the kinds of technical knowledge that you do. Okay. Oops, there we go. And that's sort of like, in some sense, so these are recent headlines. One of the Wired article from the top, and then the Atlantic on the bottom. Up top, universities must help educate woefully uninformed lawmakers. On the bottom, why Congress relies on lobbyists instead of thinking for itself. Both of these are in the US context. And I actually the point of me highlighting these is actually not to sort of like cast aspersions or stones or anything like that, but rather actually simply just to sort of underscore the point that like, you have technical knowledge. Actually, you probably already have some. You certainly will have more in the future that decision makers like don't necessarily have. And moreover, like, we can't expect them to have, because after all, like, they are being asked to make decisions, many policymakers, and not even just Congress. I mean, this would be true at like many subnational levels of government, as well as if you kind of go above to like, say, the international level, as well as other national governments that aren't the US Congress. They can't be expected to be experts on all topics. Like that's just not possible, right? And they can't. And so, so the point is simply that like, when you think about sort of your role going forward, and your goals and your aspirations, I think for many of you, it's going to be to sort of like bring the kind of technical knowledge you have to the policymaking process. And that's really the kind of question I want to focus on today. So when I said at the beginning, like, I want to sort of present stuff that like, I want you to sort of look at it and say, this is actually like kind of actionable for me. Like, yes, it is. Okay. That is absolutely the goal. All right, so how can you use your technical knowledge to inform policymaking? And if you want to sort of like kind of take it out from the kind of the you language, we can sort of ask the question at a slightly kind of broader level, and the level that actually a number of folks have written about, which I'm going to talk about in a second, which is more broadly, what is the role of technical knowledge in the policymaking process? What is it? What should it be? You know, and I think that those are really important questions and not easy to answer questions at all. So, but let me sort of like, but for the most part, as I sort of talk for the rest of the slideshow time, I'm really going to focus a lot on that kind of, I'm going to frame things often in terms of that first question, like, you know, how can you, and again, when I say you, I literally mean all of you, like on this Zoom call, use your technical knowledge to inform policymaking. So there's one very common answer to that question, right? Which is, is sometimes kind of referred to sort of like the deficit model, which is that when decision makers don't know things, which again is not like a normative judgment about whether it's good or bad or whatever, just simply when they don't know things, and they often don't know things, all of us don't know things, okay? You know, we just need to tell them, okay? In other words, and this is why it's called the deficit model, we just need to sort of fill the deficit, okay? And, you know, or fill the hole or whatever you want to, you know, pick your favorite, like, you know, terminology there, okay? And so, if you believe that, right, and it's very intuitive, we think about it all the time, we see it in our daily lives all the time, right? Then the action item that comes out of that is that those with technical knowledge or expertise, they just need to disseminate it. Like the problem is simply that people out there in the world just don't know, and so we just need to tell them, okay? So all of you just simply need to like, you know, take all the technical knowledge you already have about the issues you put in the chat box and like write it up, send it off, you know, and then go have lunch. Or dinner, depending on where you are. All right. So there's a couple of limitations with that. And in order to sort of like kind of draw out those limitations, I want to kind of do it not at like a super abstract level, but sort of talk about in terms of a couple of concrete examples. And so here's one concrete example. Some of you might remember December of 2021, at least in the US, so actually it was a little bit earlier, depending on where in the world we're focusing on. But there was a new variant of the novel coronavirus of concern that emerged, and that was the Omicron variant. And so this is a screenshot from the Centers for Disease Control and Prevention, their newsroom, and you'll see, you know, you see this is dated Wednesday, December 1st, 2021. And so the question becomes like, this is an example, right, where basically like there was a lot of new technical knowledge in the sense that like people basically, you know, people, infectious disease experts, right, like knew that there was this variant, were able to, like had a lot of data on it. The data was new. They were able to sort of model what was happening. They knew a bit about sort of what the consequences of it were. And of course, more and more data was coming in, especially at the beginning of December 2021, okay? And so the question becomes though, right? The question that I want to sort of pose to you is not like anything about that technical knowledge whatsoever. I'm actually taking that as a given, right? The question becomes, what next, right? So again, all of you in this room, I am positing, I'm assuming, right? Like, you know, have technical knowledge as you shared in the Zoom chat, and you want to, and I think many of you, you know, if not now, at some point in the future, will want to influence the policymaking process in some way. And so the question is sort of like, you know, what next? And so what I want to sort of like make the argument I want to make to you here is that like simply sort of like disseminating that information. So simply basically like, you know, you can imagine in this case, simply like having infectious disease experts essentially sort of writing up their data, you know, results and data and whatever, and just sort of sending it off, right? That like, that is not enough. And the reason why it's not enough is because, and when we, like during, say, the novel, you know, novel coronavirus at various moments, you know, we face and we still face sort of this question of like, you know, like, what do you do when you know that basically there is this infectious disease out there? Like, what do you do? What's the appropriate response? How do we even measure what's appropriate? What's the most effective response? Who, you know, who determines how we measure effectiveness and so on and so forth, right? Do we close schools or not? Do we require masks or not? You know, do we require various forms of social distancing or not? Do we institute a vaccine mandate or not? As you know, like, you know, the answers to those questions are often not like incredibly cut and dry, and people differ on them. And so, and there's different sort of and trade-offs and risk calculations that people make. And so the point is simply that, like, you know, simply sort of disseminating information doesn't necessarily sort of tell us, like, you know, okay, but what should the policy response be? And moreover, even like other questions about, you know, what authority does the government have to do this or that? What is legal? What is feasible? So on and so forth. Okay, so that's my first example of like a potential limitation of the deficit model. All right, and I'm going to come back to this in a bit. All right, so the second example, many of you mentioned, in fact, actually, arguably, I mean, it was hard to sort of keep track exactly, but arguably, sort of mental health was actually one of the was the most common mentioned issue in the chat box. And so here I want to speak about not so much mental health broadly, but sort of but mental health particularly focused on youth. And so this comes from what you see on the screen right now is a screenshot from a research brief that was actually compiled as part of a research project that I'm part of. I was not responsible for writing this, so my name's not on it, but it's part of a project that I'm part of. And it was prepared, as you kind of see, it's kind of next to the green blob. It was prepared at the request of New York County leaders. So these were like policymakers at the county level. And so for those of you who are not from the United States, or maybe even those of you who are, so you know, we have the national government, we have the state level governments, and then counties are basically sort of administrative subunits of the state. Okay, so that's sort of and so in this case, it was of the state of New York in particular. And, you know, there's a bunch of statistics here, and I don't necessarily need to read everything, right? But the point is simply that, like, you know, what the reason why this came about was because, as many of you know, I think from the chat box, you know, youth mental health is an issue of particular concern nowadays, there's a lot of sort of like, you know, there are a lot of people who are sort of like who are studying it, who are thinking about what to do, are collecting new data on it, have other kinds of sort of technical knowledge about, you know, about it and about various aspects of it and about, you know, what it looks like and what the consequences are and sort of what we're doing about it or not doing about it and so on and so forth. And so, this report was sort of published or was compiled and written essentially sort of in response to sort of a number of county leaders essentially asking for sort of, you know, like, what can we do about this in our counties? That was really the kind of core question. And so, you know, what you see here is sort of some of the kinds of data on it, proportion of youth. This is all, I should also, again, just stress, this is all United States data, but so the proportion of youth in the United States who suffered at least one major depressive episode in the last year, 13%. This was, by the way, this is very recent data. This brief was written and published in May of 2023. So this is all very recent. 100,000, the number of youth with depression who do not receive medical treatment in the last year, which is about 61% of all youth, ages 12 to 17. And then there's also disparities depending on whether folks live in more rural areas versus more urban or suburban areas. But so the question becomes from the perspective, so this brief was sent to county leaders. The question becomes, and this relates to the deficit model, or why it's called my deficit model example 2, is once local leaders know about this, local policymakers know about this, then what? And in some sense, they face all of the same kinds of questions about sort of like, you know, like what to do, what not to do, what they can do, and so on and so forth that, you know, public health decision makers face as well, or the COVID decision makers face as well. But on top of that, here, there's another question that often arises, which is that, like, if we have technical knowledge and we just basically share it, so again, for filling the deficit, one of the challenges arises that there's always this question of like, well, but, you know, like, is the data from the local area that you're dealing with? Is the data like actually sort of like any, like, let's say evidence on programs and policies, like, you know, will that actually work, like, you know, in our local area? If it works somewhere else, will it work here? And that's always an open question. Okay. So the challenge is that simply disseminating technical information is often insufficient for policy change. And that's because it's not because the technical information is unimportant, actually, to the contrary, it's incredibly important. But it often doesn't sort of dictate what the appropriate or necessarily most effective policy response should be. There are, of course, exceptions to that. But in a lot of cases, particularly with sort of more complicated problems, sometimes people call them kind of like wicked problems, but like kind of more complicated problems and multifaceted problems and difficult problems, it often doesn't really dictate what the response should be. So there is an alternative path forward. And again, this is going to sort of like lead up into sort of like what, you all can do, right? Which is, and kind of echoes the title of the talk, which is Collaborate Now, which is that those with technical knowledge, you all, can look for opportunities to build new collaborative relationships with decision makers. So again, not just disseminate information, but rather look for opportunities to build new collaborative relationships. Now, what do I mean by collaborative relationship? Well, that would be a back and forth interaction between people who bring diverse, task-relevant expertise. Oops, I'm missing a vowel there. To understanding and solving problems in their community. And if you think about, right, like what's an example of that? Well, that could be all of you. Literally, like when I talk about sort of collaborative relationships, when I define them in this way, right, that could basically entail you and a policymaker, you and any kind of decision maker. And so, I think so, like, very much like, there's a very sort of concreteness to this that I want to sort of make sure to kind of to convey. And so if we go back to the examples from before, we can see some of what I said about how, like, the deficit model often has limitations. Other folks have actually written about quite a bit. And so here, like, for example, is a news article that was published by Jay Varma. Jay Varma is a infectious disease expert who also was a consultant to the mayor of New York City during a chunk of the COVID pandemic. And basically what he's writing in this article is sort of, essentially what I said before, which is that, like, what we want is we absolutely want people with technical knowledge at the table, but that knowledge often doesn't sort of dictate like what policymakers either can do or should do because of the kinds of considerations that also just come up, which is, other kinds of sort of either whether it's values considerations, whether it's cost considerations, whether it's feasibility considerations, whether it's authority considerations, and so on and so forth and stuff. So anyway, and as you kind of, the title kind of gives it away, right? Not every question is a scientific answer. The toughest COVID-19 policy questions are matters for politicians, not health experts to decide. So that's one thing. Then with respect to youth mental health, so here's an article that was written by Megan Mullen, who actually was at Duke University, is now at the University of California, Los Angeles. This basically, she wrote a whole article that, so the title is Learning from Local Government Research Partnerships in a Fragmented Political Setting. And so that, like, when you first read that, that might sound like a little bit vague to you in terms of like what exactly she's talking about. But basically what she's talking about is, when we have evidence, let's say, that a policy worked in California, it is not necessarily clear, like a priori, that it will necessarily work in New York. It might, but it might not. And in any event, decision makers in New York are going to ask that question. Okay, and you can sort of think about that across like country as well. I think we're maybe even a little bit more used to thinking about it in terms of like, oh, we know that there was this policy, let's say in the UK, would that work in the US? Like people sort of naturally sort of ask like, okay, well, there are differences between the countries and so on and so forth. Well, that's often true here. And we often like, if you're, let's say, a local policymaker, you represent like a county or a city, you may not necessarily have like great evidence about sort of what we can do to improve youth mental health in my county or city already. And so what the best available might simply be sort of data and evidence that comes from elsewhere or comes from a different time period. And so the question becomes like, well, what can we do about that? Well, so one of the things that comes out of this article and the previous one is essentially the argument that, we need sort of like people with technical knowledge who are in collaborative relationships with decision makers. We don't just need them to share what they know. We need them to be engaging in that kind of interactive back and forth. Okay, so let me sort of step back a little bit and say a couple of kind of general things. So expertise becomes relevant in civic life, in politics, when people share it with others. That often entails new collaborative relationships, okay? To kind of drive home the point of the importance of these collaborative relationships, I want to sort of cite this. So Adam Gamarin, I'm guessing many of you are not familiar with who that is. He's not exactly a household name. He is, however, the president of a foundation that basically gives money to increase evidence-based policy in the real world. So here's somebody basically, so he wrote this article. This is an academic article. It has the title, as you can see, Evidence-Based Policy in the Real World, a Cautionary View. But I want to sort of underscore that, like, he's not just writing this and, like, you know, kind of sending it off, but he actually is sort of like literally putting his money rather where his mouth is, because he actually like funds work on this as the head of a foundation. And I want to sort of just draw your attention to sort of a piece of this article that he has. So this is the, I'm just going to read the highlighted part. As a recent National Research Council report explains, scientific evidence, quote, shares the table with an array of non-scientific reasons for making a policy choice. Personal and political beliefs and values are present, as are lessons from experience, trial and error learning, and reasoning by analogy. Obviously, political matters and pressures weigh heavily when policy choices are made. And then the sentence afterwards. So he's actually quoting on that one. But then there's that last sentence. A realistic goal is to have evidence present for consideration rather than assuming it will dominate the decision process. And the thing is, right, when I'm talking about sort of collaborative relationships, when I'm encouraging all of you to think about how you can sort of form new collaborative relationships with decision makers, essentially what I'm saying is that, like, the goal here is to make sure that evidence is present, that the technical knowledge that you have is present for consideration when decisions are getting made, and not assuming that it will dominate. Okay, so there's the two things from before. Now, here's the catch, right? On all of this, right? Because everything I've said so far, you might say, like, all right, come on, I really have to, like, I got up on Saturday morning just to hear this guy talk about sort of like why collaboration might be a good thing. Like, come on, right? But here's the thing, all right? Like, now we sort of like, there's a certain way in which the rubber hits the road that I especially want to kind of underscore, which is these collaborative relationships often don't arise on their own. And what I mean by that is I don't necessarily mean that, like, you all have not necessarily initiated them per se, but simply to say that, like, there can actually be this unmet desire for them out in the world, even right now, even among sort of existing decision makers, and even in ways that, like, might actually strike us as, like, somewhat surprising. And so I want to sort of share with you some, just like one example of that. And this comes from now papers. Now I'm citing something that I wrote called Unmet Desire. This is a paper that has data from a survey of local policymakers in the US. And this is a national level survey of local policymakers. And again, so when I say local, what I mean is, like, not state level, I mean sub-state. And so it's like county and or municipal. And so again, so national level survey. So the very first thing that this survey did is it asked these policymakers, you know, where do you get information to help you make decisions, right? Kind of fairly, you know, basic question. We gave people lots of options. And so what I'm going to do in the next slide is I'm going to just give you an overview of, like, those responses. You know, there's going to be a lot of just, like, data on the next screen, and, like, but, like, what I want to do is just sort of, like, walk through, like, a couple of pieces of it, but then kind of leave it at that. So this was, if you look on the left-hand side, this is basically, like, a whole list of kinds of people that like, policymakers, these local policymakers, okay, might get information from. So and if you look at this list, like, you should look at this list and say to yourself, like, yeah, okay, that seems reasonable, you know, or seems possible. Okay, so other government officials in your county, grassroots or business leaders, kind of go down, interest group leaders, and then at the very bottom, we have researchers at colleges and universities who are not in your immediate region, okay? And then we have researchers at colleges and universities who are within your immediate region, okay? And the more green there is, the more that they interact with those folks. The more red there is, or it's kind of sienna, then red-brown, the more that they don't interact with those people, okay? And so you can pretty clearly sort of see that, like, they, you know, pretty regularly, you know, interact with local policymakers, regularly interact with other government officials in their county. I mean, you can think about those are literally the people kind of down the hall, so to speak. But also grassroots and community leaders and business leaders. But then if you look towards the bottom, and this is kind of what I want to underscore, look at the very bottom. So this is researchers at colleges and universities within the region. So in other words, what this is, right? I want to sort of, like, try to persuade you that you should, like, be, like, you know, kind of surprised and, like, maybe a little bit shocked by this, which is that, you know, you have these, like, local policymakers you have these universities that are, in their local area. You might think that and at those universities, you have lots of people, right? Who have technical knowledge on issues, like many health issues, as well as many other kinds of issues, right? And so you might sort of think well, of course that they would talk, right? Because after all, the technical knowledge is important, in terms of data, in terms of evidence from previous studies, maybe evaluating programs, that kind of stuff, how the body works. I mean, different kinds of evidence, right? You would think yeah, of course that should be important for sort of setting policy. But actually, it turns out that almost 3/4, this is the kind of red-brown part, said that they never interacted with local researchers. And you might say, okay, well, maybe that's just the local ones. But if we expand the kind of red oval, actually, it's pretty much the same for researchers at colleges and universities outside the region as well. Why am I mentioning this to you? Remember, so the whole reason, remember how I introduced this part, right? I introduced this part and go back and said, there can be this unmet desire, okay? Well, what about that unmet desire? So then another part of the survey asks not what you already do, but what you would like to be doing. So local policymakers, would you like to be interacting with these local researchers at colleges and universities within your region? And what we found in that survey was that there was a tremendous amount of unmet desire. And so if you look at this and you sort of see, if you read the top part, existing versus desired, so what's in the dark green on the left is essentially just another way of putting the data that was on the previous slide. So local policymakers rarely collaborate with local researchers to tackle policy challenges. However, they overwhelmingly want to. And so or almost 60% rather, wanted to do so more going forward. And so again, that is an evidence of this idea that actually so collaborative relationships are really important, but they don't necessarily happen even when people might value them. Here's another way of looking at that same data, in which we said, so local policymakers are also rarely contacted by local researchers to collaborate on policy challenges. So that's again, the dark green on the left. If you look at the lighter green on the right, a large majority welcome that. And so close to 80% said, yes, I would love it for them to reach out. I would totally welcome it. And so the broader point here is simply that, again, this idea that I want to, that the deficit model, as a way of sort of having technical knowledge influence policymaking, the deficit model has limitations. Collaborative relationships are really important, but yet they don't always happen on their own. So, just to summarize. And so what I'm going to do is I'm going to basically summarize for this slide, and then I'm going to stop sharing my screen, because what I want to do is I want to make time for sort of a Q&A from all of you, and kind of hear your questions, thoughts, concerns, whatever. And happy to expand upon anything that's in here. But so first of all, again, and I guess I should just say, just going back to this for a second, I recognize that, again, all of you are not researchers at local colleges and universities, right? That's not, however, the general point here is simply that, there's a lot of unmet desire out there for collaborative relationships with people who bring technical knowledge. And so as a result, we should be thinking about sort of ways in which we can meet it if your goal is to bring technical knowledge to the policymaking process. Okay, so technical knowledge is critical for improving health. As the next generation of health leaders, you all have it, as you told me a half hour ago in the chat box, and you're getting more of it every day. Okay, and you aspire to get more of it, which is incredible, which is wonderful. It should be celebrated. There are limitations for bringing that technical knowledge to the policymaking process. There are limitations to deficit model thinking. We're simply sort of filling the cup, so to speak, isn't enough to sort of necessarily affect decision makers, but instead you can ask yourself, how can you collaborate now? How can you seek to meet unmet desire? How can you seek to create new kinds of collaborative relationships? Okay. And so with that said, I'm gonna again just go back to this final screen. I also wanted to say, and I'll stop sharing at this point. I also wanted to say, in addition to kind of making those points, I'm also happy to talk about just kind of anything biographical if anybody's interested. I know that I was told sort of that sometimes folks like to ask about that. And again, it's when I was your age, the idea that I might then a couple of decades later be say that I studied the science of collaboration, like that wasn't a thing. Like nobody sat me down and said, "Oh, are you interested in the science of collaboration?" Like that just kind of wasn't the thing, And so, if anybody was sort of curious, like how I kind of got here, I'm happy to kind of talk about that as well as anything substantive from the talk itself. So thank you so much. And yeah, I think I'll just open it up for Q&A.
Hi. First of all, I really enjoyed your presentation. I think it was really interesting, especially as an individual who wants to incorporate like more of the political science into medicine. But my main question was, how would you recommend like getting policymakers to take us seriously, especially as like high school students?
Yeah, so I think so first of all, I want to say that actually, lots of people face that challenge, right? And so it's not like, and so I think that there are from your perspective, you might say like I feel like I'm facing that challenge and like whatnot, but I think in general, like getting like people's attention, getting decision makers' attention is really, really hard. I face that challenge. Like everybody, the head of like global health leaders like faces that challenge and whatnot. And so I want to sort of just sort of like kind of like name that and say that like you are like definitely not alone in sort of thinking that like at all. So I think the main thing so one way to think about that is actually to sort of kind of adopt a kind of psychology of attention perspective, which is that that people's attention really is limited. And you simply sort of showing up and saying, here's something I care about, listen to me, yeah, may or may not be super effective at getting the attention of people who are really busy. What you can do though, one sort of like really kind of great way of sort of getting the foot in the door is to think about like what are the ways in which like the what challenges does the decision makers you want to target, what challenges are they facing? What are their sort of top priorities? And what kind of like unique knowledge do you bring to that? Knowledge and perspective do you bring to that? And like, and thinking about sort of like how to share that and how to emphasize like essentially sort of why that unique knowledge is important. And why they should sort of like why it's important, given what their goals are. So if you can sort of start with basically like their goals and like the challenges as they see it, that's really great. And just to, like give you an example of that, like that's sort of it's the difference between sort of me basically saying I have a new paper, policymaker, and like here it is, and like kind of like like waving it in their face. In which case, they might say like, well, okay, that's super interesting, but like right now I have to address this other problem, right? As opposed to me sort of saying like, oh, what kinds of challenges are you facing? And like, maybe there's like research that I know about that would be helpful. And starting with that, and at least starting with that, that's, and then over time, if you sort of like, at some moments you might say like, well, look, like, they need to be thinking about something or talking about something that they aren't talking about. But if you've already kind of gone through that relationship building process, it's a lot easier for you to basically at that point say, look, like that I have like important things to say. Can you hear me out on this other thing that you may not already be thinking about? It's just hard to do that when you don't know them already. One other thing, actually, I'll just say on that is that when I've done outreach to local policymakers, we've had way more success doing that. We've had very little success, like almost no success, just emailing policymakers, like local policy, very little success. Much more success going to their open meetings, because at least in the US, and states differ on this, and certainly countries differ on this, but the meetings of the local legislatures are often open to the public, and they're often like have to be open. And there's often like an open mic session. And so going and basically introducing myself or ourselves during the open mic session is way more effective at getting them interested in talking to us. So anyways, those are some of the kinds of things. But what's interesting is I think the question is a really like important one. And I think it kind of underscores how, it's very easy for strangers to remain strangers if left to their own devices. And so, we want to sort of like take seriously kind of the psychology of relationality when thinking about sort of how to kind of, build a collaborative relationship anew.
Thank you. That really helped.
Thanks for the question. Next, I'll go to a question in the chat that has a lot of thumbs ups. It's from Tassin in Virginia. She says, how do we decide as future collaborators with policymakers what issues take priority? And how do we categorize these issues when everyone will potentially bring different opinions to the table?
That's a really great question. That's a hard question. There's no real easy answer to that. And I think that, one of the kind of, I think, core things that happens in politics, basically, so politics sort of presumes sort of disagreement, right? I mean, that's sort of like the very basic nature of sort of politics, or presumes that there's disagreement. And if we're talking about sort of democratic politics, small d democratic politics, then what we're sort of thinking about sort of politics, that takes place in certain kinds of small d democratic institutions. But a lot of that sort of like that conflict and procedures for conflict resolution, is in part about kind of like what we should be talking about, what the agenda should be, not only sort of what we should do about things that are already on the agenda. Some of the work, some of the best work on kind of like sort of how issues sort of become part of the agenda, really do sort of underscore that, they often, first of all, many issues don't get on the agenda, as many of you know, but also that, there's usually sort of a confluence of kind of, politicians / decision makers are sort of, they're sort of interested in the issue. There's actually sort of like some kinds of like solutions and like new data and evidence about what to do about it. And it actually is a bit of a, maybe there's like some sort of event in the world that kind of, sort of stresses the urgency. And so there's one of the most influential models of agenda setting is this kind of, basically it's called like 3 streams. It's actually kind of a nice analogy in a way, but sort of this idea that sort of you have this kind of political stream of what are the sort of policymakers sort of like focused on, what is public opinion focused on, things like that. But then you also sort of have the political stream. Then you have like this kind of policy stream, which is more about like what kinds of new data and evidence do we have about solutions that could be effective. So again, the kind of technical knowledge that many of you probably already have that I think many decision makers probably don't have or aren't aware of yet. And then also the problem stream, which is sort of, this idea about, what kinds of problems are arising in the world. And so when there's this kind of confluence of the 3 streams, then, there's this kind of window for policy change. I think that's one model, but it sort of underscores all of this sort of, you don't have to remember the 3 streams thing, but like all this sort of underscores just simply like, the kinds of like, factors that may need to sort of be aligned in the world in order to kind of like set the agenda. So, and again, if you think about it for a second, actually, let me sort of like just abstract away from the kind of like political sciencey language for a second, but just sort of, intuitively, everything I just said should hopefully kind of make sense. That like, so you need this sort of like technical knowledge about like, well, there's this like thing that might be a good idea to do, or whatever, or this, data that like, suggests like a problem, or whatever. And then maybe sort of something in the world happens and that kind of gets people's attention, like, because it's on the news and whatever. And oh, by the way, sort of public opinion and let's say, political coalitions are aligned to say we need to do something about this. So sort of, that alignment is really, if you think about it for a second, you might say, oh yeah, okay, that kind of makes sense. So.
Great, thank you. Next, we'll go to Thomas from South Carolina, who has his hand raised.
Yes, hi, thank you so much for meeting with us today. My question was, so this previous year, I took AP capstone seminar, and for like my first research, I researched teen vaping, and I was actually the one that commented about teen vaping. So I researched the medical effects of it, my friend researched the social effects, and then my other friend researched the political effects of it, and he found basically that all the laws and policies in schools and in local governments that are in place are basically failing, because obviously teen vaping is still a really prevalent issue and teens are still having access to vapes and still are vaping. So from your personal experience, when policies are failing, what would you say like your next step is?
Yeah, so I think so that's a great question. You guys asked really good questions, and I want to underscore, right? Like none of this, like policy change is really hard and often doesn't happen and stuff like that. I mean, and I'm saying that from, I say that not from a position of sort of trying to be demoralizing, actually not at all, but rather sort of trying to be empowering, just to sort of, you know, because and to say like, you know, you are empowered if you sort of like know that up front and like, you know, and move forward, like, you know, with you know, that kind of in your toolkit, that recognition in your toolkit. So in terms of this case, I mean, so one possibility is that you know, so actually, let me say a couple of things. So one is sort of, you know, one of the challenges I think for, you know, folks who are, as I guess you are, I didn't quite see the kind of the age, but you know, if you're under sort of like voting age, right? It's, you know, it can be hard to sort of get like, you know, politicians who are sort of trying to get reelected, I think, to pay attention to you. I think that's, you know, I mean, however, if you can sort of build kind of like coalitions with other people and who maybe like don't necessarily see themselves as like, you know, thinking about teen vaping or, you know, interested in it right now or whatever, but sort of build coalitions with them to sort of say, you know, look, like, here's why, you know, like you should be concerned with this. And again, sort of starting, this kind of echoes my response to the first question, like kind of think about like, you know, what do they care about? And given what they care about, you know, here's why they should be concerned about teen vaping, and kind of like structure the argument in that way. And it might mean sort of like reframing it. So it's not so much about it is about teen vaping, but it's like, especially sort of, it's about like, let's say, you know, the like mental health consequences of it, or mental health aspects of it, or maybe it's about the you know, educational consequences of it, or, you know, any, whatever it is, right? And so I think that like thinking about sort of, you know, who you can sort of, what kinds of coalitions you can build, and essentially like what you're doing at that point is you're trying to sort of build a political constituency of folks who can sort of like push for change. And maybe you're, and again, I think to kind of underscore the beginning of what I said, I mean, you know, to the extent you can do that with folks who, you know, are sort of like constituents of the decision makers, that's like especially sort of powerful. Because one of the things that, you know, whenever I've sort of met with, let's say, like Congress people in the US, like, you know, gone to like Capitol Hill in Washington, and, you know, let's say been like part of a group or whatever, you know, when you go into an office, one of the very first questions that the policymaker or the staff member will often ask you is, you know, are you a constituent? And, you know, you might basically have like, you know, like the best data and technical knowledge in the world on like, you know, an incredibly important problem, but that is still the first question you're going to get. And if the answer to that question is no, you know, it's going to be a lot harder to get them to pay attention to you. And so I think that, you know, thinking in terms of kind of that kind of broader sort of like coalition or constituency building, and especially with folks who, you know, are perceived as constituents right now, for better or for worse, is a really kind of, you know, effective next step. And often I think that might entail, maybe not, but that could entail sort of, you know, kind of you know, thinking about sort of, you know, ways to talk about the consequences of teen vaping, in, you know, and how that sort of connects to issues that other folks are already concerned about as well.
Thank you
so much.
Next, we'll go to a question in the chat that has over 20 thumbs ups. It is from Deborah in California. She asked, how do you think we could do things locally to address policies as high schoolers?
Yeah, so I think one of the thank you for that question. It's great, and it's great to, you know, have you sort of, you know, thinking about that and kind of what that could look like. And I think, you know, one of the best ways to start is to think about, you know, is to, you know, have a good understanding of just kind of like how decisions get made, and so like kind of who has authority over what kinds of things. And then also have a sense of, you know, what kinds of things are happening, you know, in your, let's say, local area, that you don't necessarily like, you know much, that you do know much about, rather, but that there isn't something happening about. And then like, and from that, you could basically, there's this kind of idea of like power mapping, where you could basically sort of try to sort of map out like, you know, who basically sort of has power like on that issue. And then sort of, you know, think about sort of like, how can you sort of try to approach those folks in ways that are likely to be sort of like most effective. And, you know, who else might you need to have in the room, and so on and so forth. But I think that, like, you know, starting from the perspective of, you know, kind of, like who sort of is responsible for what. And then saying, okay, what issues do I think we need to to prioritize that maybe aren't getting prioritized right now? What can we do about it? And then kind of, seeking to sort of, build collaborative relationships with them is an incredibly sort of like concrete next step. And again, sort of typically the way that you would do that, like from a very kind of nuts and bolts perspective, I didn't really get into this. I'm glad folks are asking about this, like now, because I was trying to keep the kind of presentation part a little bit shorter. But again, one thing you can do is you can basically go to them and, say like, what kinds of challenges do you see going on in our local town related to, education, or related to social services, or related to environmental protection, or, whatever the issue, or related to food security, whatever the issue is. And you can sort of like, use that as sort of an entry point. But again, that's really, the other thing too, by the way, for what it's worth, like, you might like listen to me say that and say to yourself, like, okay, fine, like, again, like I got up early on a Saturday morning just to hear a guy say like, I should ask questions. Yeah, kind of. I mean, however, you should know that like, that's not what policymakers are used to people doing. Policymakers are used to basically people walking in the door with an agenda, which might be a great agenda. I mean, I want to start, I don't, whatever, like, and like, basically like telling policymakers like what they think they should do, or asking them for a favor. Having somebody walk in the door and say, what challenges are you facing on like, let's say an issue or a set of issues, like that is unusual, and like, and moreover, actually, like, what challenges are you facing? And like, is there anything like I can do, and here are the organizations I'm part of. Here are the like, at school, here are the kinds of like local neighborhood organizations I'm part of, right? Here are some of the organizations my parents are part of, things like that. And, that's, again, I won't say it's rocket science because it's not rocket science, right? But it is sort of like kind of the fundamentals of sort of relationship building that are often missed. Even if we know this in like our everyday lives, are often missed when people sort of enter the door of policymakers. So yeah, that would be, but like literally, like that would be like if I were you, like literally that would be like the like to-do items for tomorrow, or maybe I guess tomorrow's Monday.
Thank you. Next we'll go to Danielle from Delaware.
Hi, my name is Danielle. I'm a rising senior in Delaware. As mentioned, I found this presentation to be very insightful to try to connect the two groups between technicality and policymaking, which is something I sort of considered because I was in this group for land use planning, just directly with policy making. So I did have a question about the deficit model not being feasible, because I believe I missed the part about one of the limitations. So could you re-explain the youth mental health as a limitation in the deficit model?
Oh, yes. So thank you for that question. Absolutely. And land use is a great example of another kind of issue, but very much a public health issue, where there are the technical knowledge often sort of like, is certainly like should be one piece of the puzzle, but often doesn't necessarily like is not enough to kind of say, dictate what policy should be. And so even if people might like it to be, it isn't. So the example, what was going on with sort of the mental health example was there were these local policymakers in upstate New York who basically said like one of the challenges that we are facing is related to youth mental health. We're not really sure what to do about it. And so the question was essentially like, is there, and so the question to basically me and my kind of co-investigators essentially was sort of like, is there any sort of like, knowledge, data, evidence out there that we can sort of use to try to inform like what we might do about it? Like how can we improve mental health in our area? And so so what we did is we created the brief that I talked about, and I gave a little screenshot of, but the question is, so that's all kind of the background. So then the question is sort of like, all right, is it enough to basically create that brief and send it off, like email it off and then go to lunch? Or, is that like, are there limitations to that? And so the argument I was trying to make to you is that like, there are limitations to that in that example, because the problem is that all of that data and evidence is not specific to the local area where any county policymaker is working, right? So, and you saw this on the screenshot, right? None of the data that I shared with you is about any particular county. It's about sort of either the US, or it's about the state of New York, or, you know, whatever, or it's about like maybe the state of New York at some point in the past, and, you know, say before the COVID pandemic, or whatever. And so anyway, the argument there was sort of that, like, you know, simply sort of trying to kind of like fill the deficit by sort of like, you know, disseminating the information, that's not really enough for influencing policy, because what the policymakers really need is an opportunity for a like back and forth to say like, okay, you know, how well should we think that like this thing that was tried in California might work well in New York, or not work well, you know, given like our local context, and also given our budget constraints and things like that. And those are very sort of just like practical, realities that they have to face. And so anyway, that was kind of that was the argument there. Let me actually just do a quick follow up and just say, does that help clarify it? Sorry if it wasn't clear before.
Yes, it does. Thank you.
Do you have any other follow up questions on that? Because I just want to make sure, because I'm guessing if you had if you were uncertain about that, you're not the only one. And so I want to just make space for if there's any other questions that immediately come to mind, given what I just said. Or do you want to let somebody else go?
No, I think that clarified it pretty well. I was just confused about where that came from as a limitation. But yeah.
That's just because I didn't explain it well enough the first time. So thank you for asking. Cool.
Thank you. So next I'll go to a popular question in the chat from Alyssa in California. She asked, what are some reasons why some policymakers don't want more collaboration with local ones? It was interesting how some people wanted less collaboration, even though most only collaborate once a year.
Yeah, so there was another part of the survey that actually measured these hesitations. And it asked the policymakers, when you think about sort of interacting with a local researcher, do you have any of the following concerns? And there was kind of a list of concerns, and they basically just answer yes or no. So like yes or no to each of them. And so no concern was shared by like a large majority of people, but there were some that were at like more frequent than others. And so the topmost concern was that the researcher is just going to push a political agenda. That was shared by about 45% of the respondents. So not a majority, but certainly not a trivial percentage at all. And so that was one thing. The second is that, and this was about maybe 1/3, is that they were concerned that the researchers would not share practical information, which kind of is interesting, because I think, it kind of underscores how, what you learn when you learn about like, how the body works, right? Or how sort of, land use policy has been crafted, or, like whatever, right? It doesn't necessarily mean that you're going to sort of be able to offer sort of practical information for your audience. I mean, heck, as I said to you at the beginning of this talk, my hope is that you walk out of our time together with like a sense of practical information, and maybe you will, maybe you won't. But anyway, the hope is you do to some extent. But then there was also other kinds of concerns that, like, were relatively popular, in addition to those two. And so, for example, the idea that researchers might not respect their knowledge and expertise as a policymaker. And that kind of reflects this idea it's researchers, when they interact in the policy sphere, this is kind of the opposite of collaborative relationship building. Well, sometimes, and I've actually interviewed some local policymakers kind of on this, and so they'll share stories and whatnot. But they'll talk about essentially sort of researchers sort of showing up, sharing what they know, and then it's almost like mic drop, and then they leave, kind of thing. And that's not really sort of saying, that doesn't demonstrate a desire to actually talk about like what would it look like to sort of have this technical knowledge inform policy here. Because for that, you have to learn about the local context. You have to learn about what's been tried in the past. You have to learn about what costs consider, like all that kind of stuff. And again, not because any individual researcher is going to be able to sort of sort all that out. Of course not, right? But the idea is simply that like that stuff does matter for actually having technical knowledge influencing policy. So anyway, so those were some of the kind of common ones. They're going to push a political agenda. So another way of thinking about that is basically they're not going to share trustworthy information. This is kind of another way of thinking about that. And then they're not going to share practical information. And then they're not going to respect my knowledge and experience as a policymaker. There were others too, but yeah.
Thank you. Next, we'll go to Archon from California.
Yeah, thank you, Dr. Levine. I really enjoyed hearing about your presentation, and I really enjoyed learning about it. So one question, I have two questions. One question is, can you please expand more about your deficit model, and the deficit model, and how we can use it in society as high schoolers?
Sure. And so, by the way, you also so California, so you were up at 8 a.m. for this.
Yep, I actually got up at 5 or 6 just to make sure I got the presentation going.
Look at that. I don't know if there's anybody from Hawaii. That's kind of what I imagine, or Alaska maybe, might be earlier, but anyway, there's anybody from Hawaii or Alaska, wow, 2 thumbs up. But California though was for Saturday morning. Yeah, so the thing about that, and what's interesting, right? And I'm really glad you asked this, because it underscores how it's not that the deficit model, as a way of sort of bringing technical knowledge to policy, it's not that it's complete garbage or anything, far from it. It's just so the point is simply, if you want to directly influence decision makers, it often has limitations for some of the reasons I described. But if the goal, for example, is simply to inform a large number of people. So sometimes what happens in the policy process is that and I'm going to use this as kind of a slightly technical term, but it kind of, I think it's fairly self-explanatory what it is. There's this idea of sort of called conflict expansion, or kind of expanding the conflict. And what that refers to is sort of basically if people sort of in power aren't doing something. This kind of also speaks to the teen vaping example question from earlier too. If people in power aren't doing something, one thing that you could let's say you're a citizen sitting there thinking geez, they need to be doing something, I really we need to push them to do something and act. One thing that folks do is they'll basically do they'll try to raise awareness in the broader public. And so one thing that the deficit model can be really good at is sort of raising awareness and just sort of saying there is this problem. You might not know about it, but it's out there. And if you think about sort of what does the news media do, right? One of the major things that the news media does, and does quite powerfully, is let people know about problems. And when the news media chooses to focus on things, there's evidence of this, right? When the news media chooses to focus on stuff, concern about it will increase. Well, you might say well, look, I don't run a news media organization, so why are you telling me this? Well, okay, fine. But, one thing you can do is, well, maybe you do actually run maybe you have a local podcast, or maybe you have some sort of a local radio station. Even if you don't have that, right? You might you could put up, heck, you could even do old school, putting up flyers. You could be posting stuff to a local social networking group. You could be putting stuff on TikTok. That kind of stuff is actually all of which is basically sort of, you can think of it as essentially sort of filling a deficit, right? And again, it often sort of has limitations for directly influencing policy, because that technical knowledge often isn't enough to actually, affect policy. But if the goal is simply to inform people there's this problem out there we're not paying attention to, it can be really powerful. So I'm really glad you asked that, because and it really sort of, I want to kind of absolutely underscore, that's why I choose the words carefully in the slides when I say limitations of, I don't say, don't do this, don't ever do this, kind of thing. So yeah, anyway.
Okay, so my second question is that so basically I've heard that you're also currently studying the role of science in American life. And I just want to, this may seem a little off topic, but I was wondering, what have you found so far within your research? Is there a way you could share it with us?
Well, yeah, okay, so that is, so first of all, how much time do you have?
I think it's 9:06 a.m. at my end, which means it's probably 12 o'clock Eastern time.
Great, so as long as you don't have dinner plans today or tomorrow, we can get through all of it. But seriously, so that would be, I appreciate you asking. I would say one of the things, sometimes when I talk about that stuff, actually, the pithiest way in which I'll summarize it. So I'll say this for now, and I'm only saying it for time because a lot of folks do have their hands up, and I want to give them time to ask, to at least try to get through some of the questions. But we are often used to, at least in American politics, but also not only in American politics, I should say, but like we are used to thinking about sort of politicians as being like labeled as either pro-science or anti-science. And one of the things I find in my research is that there's actually a pretty large unmet desire for science. And so I think that, one of the things that I think is really important is thinking about how can we measure that, which is like what I do in that survey, for example, like I showed you. But then also, and I didn't show you this part, how can we meet it? And like what works to meet it? To actually to meet the unmet desire. And I think so another key part of my research is actually sort of about that. Part of those research briefs on youth mental health that I mentioned is like one kind of piece of that work, but there's a lot more to it as well. So, but anyway, let me leave it at that for now, just kind of in the interest of time. But I do appreciate you asking, yeah.
Thank you. I'll see if I can follow up in an email if I have any more questions, because I am pretty sure other people have it, but thank you very much.
Thank you.
Thank you. And we'll try to get to as many questions as we can, but to be respectful of Dr. Levine's time, he does have to go at 12:15 Eastern. But next we will go to Jay from California.
Hi, Dr. Levine. I just want to thank you for your amazing presentation. I thought it was really surprising how much unmet desire there was. And I've done previous research like on mental health, and I want to help pursue, local policy change. And so how would you suggest using past research experiences to kind of pursue more opportunities for research and more opportunities to collaborate with local policymakers to kind of bridge the divide in unmet desires?
Yeah, so no, thank you for asking that. And so what I would say is like, the first question you might sort of ask yourself is, to what extent do you see, or actually, I'll put it differently, which, if any, local leaders seem already concerned about the problem. And like in the sense that they've made public statements about it, or, if you happen to know about like family circumstances that might make them especially interested, in anything kind of like that. Because what's nice about that in a way is that like, if you say, look, I'm concerned about this, and, I want to sort of like try to move the ball forward from a local policy perspective, one nice thing is that like, if you know that they're already concerned about it as well, then it's like you're pushing against an open door. And that's a lot easier than pushing against a closed door. To push the analogy further than it should go. And so I think like, you can think of it, and you can be sort of like, and it's especially great, and this kind of echoes something I said a little bit earlier, like if you can sort of focus on kind of the set of decision makers who, are both like concerned about the issue and also have authority over it. And those aren't necessarily the same people, but like, and this is where sort of like, kind of having a sense of sort of, who does actually have authority in the local area. I don't know, in your case, I know for me growing up, like we never learned. I think I can pretty like confidently say this. Like I rather never learned about like local politics. Like that was not part of like classroom instruction. That was not like something that like I might have had some sort of like, I don't know, maybe a field trip once. I'm not remembering, but anyway, but there certainly was not a lot. Whereas, we learned a lot about U.S. politics. I'm saying that you're in the U.S. So for the non-U.S. people, I'm sure you learned a lot about national politics, right? I grew up in New Jersey. I learned a bit about New Jersey politics, but not even that much, right? But certainly, if you want to talk about local politics, no. And I didn't grow up in a big city. Maybe if I'd grown up in like a New York City, it would have been a little bit different. But and so anyway, I mentioned that simply to say that like, you might not totally know who has authority over whatever. And I think that's totally okay. And moreover, you might actually sort of reach out and like, and sort of say like, can you tell me about the kinds of things you're thinking about or, worried about or wanting to work on with respect to, say, for example, youth mental health or any other issue. And, the person might, not want to talk to you, or might just say like, I don't have authority over this, or more just simply say I am concerned, but now is a terrible time. Like there might be any number of responses. And I think that like, you have to sort of go into it with the mindset of, okay, who else can I build a collaborative relationship with? And even ask them. And like ask them, okay, well, who do you think I should be talking to as well? And I think that, and if you go in it from this perspective of like, I actually think there might be a lot of unmet desire. It doesn't necessarily mean that everybody you talk to is going to be like, oh, thank goodness somebody has finally gotten in touch with me, right? No, they might not be. But at the very least, like you sort of like, say, well, okay, this maybe didn't work out, but like, who else maybe do you think I should talk to? And so on and so forth. And then you sort of can like kind of, and that can kind of hook up with my answer to one of the earlier questions about, okay, then when you're talking to that person, what do you say? Well, one thing you can sort of say, instead of sort of like just, like kind of shoving research results in their face, say, start by saying like, what kinds of things are you concerned about? What are your priorities and what are your goals? And then kind of going from there.
Thank you. I appreciate it.
Thank you. We'll probably have time for a couple of more questions. Next, I see, sorry if I mispronounced your name, Siam from Missouri.
Oh yeah. Hi, I'm Kian. I'm a rising junior from Missouri. I actually read some of your work, Dr. Levine, and some of my own projects. So thank you for saving the grade. But I wanted to ask, how do you sort of see like professional relationships specifically between like scientists and decision makers sort of being maintained even after like a sort of initial contact?
Yeah, so I think that like, one of the things that like I think is really sort of helpful for that is that well, let me put it differently. So first of all, I think that I want to sort of actually like first just kind of echo that like I think that this is a really important point that like, just because you have an initial contact doesn't necessarily mean you're going to have follow-up contacts. And moreover, that like you shouldn't take evidence that they don't call you back as evidence that they don't want to talk to you. Because probably the more likely thing is just that they're busy. Because any sort of, particularly if we're talking about elected folks, but even if we're talking about sort of, bureaucrats, like non-elected folks, like, it is not necessarily the case, like they're often working on many, many different issues. And so, I think like, at least starting from the presumption of they're really busy. And so, it's easier for me to reach out than vice versa is I think a really good starting point until you learn otherwise. Let's put it that way. And so I think that that's exactly right. And so like following up and sort of, in ways that reference your previous interaction is actually really great from a relationship building perspective. And so not, so you can sort of say like, oh, I'm just following up on the thing that we talked about the last time, because I might not remember the thing you talked about the last time. And then saying, because they're having meetings all the time and lots of different issues. And then sort of like saying, oh, and by the way, the reason why I'm following up is X, Y, and Z. And so then you sort of like make reference to a previous sort of like episode of relationship building, like, we have this, and then sort of like moving forward. And that's it on the relationship side. But then on the information side, if you are just viewed as like one more like, and I say you in terms of like a person with sort of technical knowledge on a topic, right? If you're basically just sort of viewed as like one more person that's pushing for something, well, then you're just kind of one more person. It's like whatever. But if you're like actually saying, no, like I'm actually going to try to be an honest broker. Like I'm going to try to basically say like I think that there is this data and evidence that is really important. It may not necessarily sort of be, and this kind of echoes like what was in the talk, right? It may not necessarily be like exactly what like policy like needs to be pursued. It may not quite point in that direction, but at least it's sort of like it should be at the table. And this kind of echoes the quote from that foundation professor or foundation president that I cited, right? Like, and so like I'm just gonna sort of like try to kind of like lay that out there and make sure it's part of the conversation, and you sort of like do that over and over again, then you gain a reputation for that as well. And so I think so part of the answer to your question is about the kind of like the relationship building of, sort of making sure to follow up and sort of referring back to what you did in the past and being clear about the reason why you're following up. And like very explicitly, like the reason why I'm following up is that like, and like very explicitly saying that. And thank you so much for, meeting with, for our conversation last Tuesday about X, Y, and Z, like very explicitly sort of saying that. And then, and then from there, also sort of, having an eye towards like, how is it that you can sort of basically, be an honest broker and not simply be sort of pushing for some other, special, whatever that like everybody else is doing. Thank you so much. It's great to virtually meet many of you, and And again, sort of, like I would say keep doing what you're doing. And it's so great especially there's so many people who basically were like, look, yes, I have technical knowledge. I want to bring it to the policymaking process. And so I hope that you at least sort of walk away from today with a little bit of a sort of, greater sense of like, yeah, what can you do literally tomorrow or this afternoon? So thank you so much.